Hello, everyone. Well, first of all, I'd like to say it's a great pleasure and honor to be with you to talk about hope. On behalf of my team, I'd like to thank the Pierre Fabre Foundation for having invited us to the eHealth conference and also giving us to the opportunity of presenting my project. I'm an IT. I'm also the co-founder of my Hope project. So once upon a time, there was a very ambitious young girl. Her name was Fadou, and she was living in a faraway community. So Mayel is a young man, and Fatou is pregnant. And on the day of delivery, she's going to be so far away. And so during the journey, she loses a lot of blood. When she gets to the hospital, they are able to save the child, but unfortunately, the mother did not survive. Fatou did not survive because of hemorrhagia. There was not enough blood in the hospital. According to the WHO, just like Fatou, every woman dies every minute in the world because of lack of blood. Over 65% of blood transfusions are given to young children. And so for this reason, we have decided to create Hope, the first digital platform to encourage populations to donate their blood, and the idea is to reduce mortality. In Senegal, only 0.45% of the population gives their blood, and this is not sufficient. Why? Mainly prejudices, pre-thought ideas on blood donation, and it's very difficult to change the minds of people. We don't have enough communication tools, we don't have any education, and I think Hope wants to be different from all these costly methods. So the idea we're able to have innovations. As you know, we are all connected with internet and smartphones, social networks, and the penetration rate of mobile has been over 100% in African countries. So digital is a great way of creating an interconnected blood donor network. So we can use this in order to communicate more with the donors and also attract new donors, especially in emergency situations. So Hope is the app platform, web, mobile, and SMS, and thanks to that, the health structures can really boost the rate of blood donation. So we've developed the app. It's now available on the Google iStore, and we could even ask questions on forums, or for example, if you have a specific emergency, so they could make an announcement. So we work also in R&D, and that is why we've decided to have a chat book, Hope, so that people can register through social networks. You can be volunteers in case of an emergency, but also for the patients to be able to find compatible donors in case of need. Hope was created in May 2015, and between May and December, we were able to carry out surveys, feasibility of the project, but also the environment of blood donation in Senegal. In 2016, we officially kicked off the project, 6 months for pilot phase, National Transfusion Center, and so during this phase, we have been able to contact 30,000 people through our platform. What's essential to see is that in only 6 months, we multiplied by 3 the blood donations. So it's really a great way of showing the impact of what we do in a city and a country. Today, we are looking for more initiatives, more funding partners in a city, in a country, and in the short term, we hope to be present in all the health structures in Senegal. Longer term, our ambition is also to scale up in different African countries that also have the same problems, the same needs with their blood donations. For one example is French-speaking African countries, Mauritania, Cameroon, Togo, and they don't have enough blood donations. So hope is the hope for Africa, for a better world, in where duty is to give your blood so that no one dies because of lack of blood. Thank you for your attention.